Welcome to the Deep Dive.
Great to be here.
Today we're tackling something that really affects everyone, how healthcare organizations maintain quality, and maybe more importantly, how you can be better prepared for your own doctor's visits.
We've gathered info from some big names like Joint Commission International JCI, that is, and India's NABH, the National Accreditation Board for Hospitals and Healthcare Providers.
And also insights from Supremedic Consultancy, HospiMatch, and, practical tips on patient prep.
Yeah, our mission today is really to pull out the key stuff about healthcare quality standards, how places actually achieve them.
And then turn that into actionable steps for you, the listener, so your healthcare visits are, hopefully, more effective and less stressful.
Exactly. Whether you're just curious about how hospitals get those quality badges or you want to walk into your next appointment feeling a bit more, confident and in control.
This deep dive should give you some valuable takeaways. Okay, ready to jump in?
Let's do it. So first up, understanding this whole healthcare accreditation thing.
Right. Our sources really point to two major players here, JCI and NABH.
Let's start with JCI, Joint Commission International. They're known globally, right?
Yeah, definitely. Seen as a leader for, over 20 years now in quality and, crucially, patient safety. Their mission is pretty clear: to enable and affirm the highest standards of healthcare quality and patient safety for all.
And they're not small scale. They work in, over 70 countries?
That's right. And they've accredited or certified more than 1,000 programs. They've got a network of 600 experts worldwide helping them out.
It's impressive. And what they offer is quite broad, too. It's not just hospital accreditation.
No, exactly. They do certifications for specific clinical care programs, healthcare sustainability, even telehealth now.
And they develop these really rigorous international standards. The international patient safety goals, those seem particularly important.
They really do. They focus on preventing the most common serious errors in healthcare. It's like a targeted roadmap for safety.
It's practical, not just theory.
Totally. And you see that impact in what accredited places say. JCI shared feedback, like from Hong Kong Adventist hospitals. They said the process was excellent for team building.
Oh, interesting. So it actually improves how people work together. Coordination, communication.
Seems like it. And Burjeel Farha Hospital in the UAE mentioned it gives them a competitive edge, builds community trust.
And improves risk management, fosters a whole culture of patient safety. That's huge.
Emirates Specialty Hospital also talked about the added value, how it boosts patient confidence.
And Corniche Hospital, they've got the JCI Gold Seal. They see it as proof of their continuous commitment to excellence, aligning with top international standards.
So it really pushes this idea of always improving. It's not a one-and-done thing.
Absolutely not. Continuous improvement is key. Now let's shift focus a bit to India with NABH.
Right. The National Accreditation Board for Hospitals and Healthcare Providers, part of the Quality Council of India.
And their job is basically setting up and running accreditation specifically for India's healthcare organizations.
Catering to local needs, setting benchmarks within the country.
Yeah, and they operate with full autonomy, it says, but supported by stakeholders. Interesting balance.
So JCI is global, NABH is India-focused, but the core idea seems similar.
Exactly. Accreditation, fundamentally, is about measuring, assessing, and ultimately improving performance.
It gives organizations a framework, helps them tackle specific safety issues using these defined goals and standards.
And like we heard with JCI, it can give that competitive advantage, build trust. It signals a real commitment.
Right. Always improving, always implementing best practices. Which kind of leads us to Supremedic, doesn't it? How do these standards get put into practice?
Good transition. Yes, Supremedic Consultancy. They position themselves as partners for hospital owners.
Helping them from the very beginning, planning stages right through to getting accredited, like a guide through the whole process.
And they focus on the practical side, consulting on how to actually implement best practices in daily operations, improve performance.
And they specifically offer NABH accreditation support. So hands-on help.
Yeah, they really bridge that gap between the standards on paper and the reality of running a hospital.
They also work with investors, it seems, helping strategize healthcare ideas, sometimes taking equity.
That's an interesting model, isn't it? It connects quality directly to investment. They offer a whole suite of services, hospital design, recruitment, setting up quality management systems for NABH, even NABL.
NABL?
National Accreditation Board for Testing and Calibration Laboratories. So lab quality, basically.
Got it. So labs, equipment procurement, it's comprehensive.
It really underscores that accreditation isn't just, a piece of paper. It needs solid infrastructure, good day-to-day management, sticking to standards everywhere.
Embedding quality deep down. Okay, let's switch gears now. Let's talk about what you, the listener, can do. Preparing for your own healthcare visits.
Yes, this is where the advice from sources like Lifelines comes in. The core message is simple. Being prepared leads to better care.
It just makes sense, doesn't it?
It really does. Lifelines points out if you go in unprepared, you risk things like incomplete diagnoses, needing more appointments.
Wasting time, money.
Exactly, and delaying treatment decisions. But if you're prepared, you actually help your doctor work faster, more accurately, and more safely. You become a partner in your care.
Okay, so what are the practical steps? We pulled together a checklist. First big one, carry your medical records.
Sounds basic, but it's vital. Previous prescriptions, lab reports, x-rays, scan results, discharge summaries, basically your history.
And how to manage all that. A folder. Apps.
Yeah, the checklist suggests a simple folder works, or you can use digital tools. Things like CU22 or DigiLocker in India, or hospital patient portals if they offer them.
What else for records?
A current list of all your medications. Prescription, over-the-counter, vitamins, supplements with the dosages. That's really important.
Okay. And your overall medical history, past conditions, surgeries.
Yep. And maybe names and contacts for other doctors you see, if it's relevant.
Makes sense. What's next on the checklist? Symptoms.
Right. Write down your symptoms clearly. Don't just say, I feel unwell. Note when they started, how often they happen, any triggers like food, time of day, stress.
And how bad they are. Mild, moderate, severe.
Exactly. Putting that down helps you explain it better during the visit.
Okay. Records, symptoms. Questions. Prepare questions you want to ask.
Yes, this is so important for feeling informed. Examples given were things like, is this condition temporary or long-term? Do I need more tests or a specialist?
Could I change my diet or lifestyle? What are the side effects of this medication?
Having those ready means you won't forget in the moment.
Good point. What else? Allergies and conditions.
Crucial. Note down any allergies, meds, food, materials like latex or iodine, and existing conditions. Diabetes, high blood pressure, heart disease, asthma, whatever applies to you.
This can really affect treatment choices.
Okay, practical stuff. Insurance.
If applicable, yes. Bring your insurance card, policy details, even an e-card, and your ID proof. Especially for planned procedures or specialist visits at private hospitals.
Oh, fasting before tests. Yeah, sometimes you need to. Like for blood sugar or lipid profile tests. The advice is to ask ahead of time if fasting is required.
And don't self-medicate right before you go.
Right. Avoid taking over-the-counter stuff that might mask your symptoms. Just follow any specific instructions you were given for tests or scans.
Okay. What about bringing someone with you?
That can be really helpful, especially for elderly patients or if there's a language barrier or just for emotional support and help remembering things.
Good idea. But maybe not the whole family.
Generally, yeah. They suggest avoiding overcrowding. Usually just one attendant is best.
And finally, the simple but vital one, be on time.
Yes. Aim for maybe 10-15 minutes early. Being late can cause delays, even cancellations. It just adds stress.
Definitely. The sources also mention some situations need extra prep.
They did. Like a first-time visit, bring your full health history and ID. For a child's appointment, maybe their vaccination record, growth chart, any school concerns.
Chronic illness review. Bring recent tests. Track your symptoms.
And for a mental health visit, maybe notes on your mood, sleep, any family concerns. Context helps.
And there were also things to avoid doing.
Yeah, important too. Don't guess or hide symptoms. Don't take that OTC medicine beforehand, like we said. Don't assume the doctor magically knows your whole history.
Then always ask about next steps. Don't leave unsure.
Absolutely. Which actually leads nicely into the benefits of just arriving early and being organized. The Lifelines source really emphasized this.
Right? It's not just polite. It genuinely helps you, reduces stress, keeps you calm. Rushing is never good.
No. And it gives you time for the admin stuff, filling forms, updating info, insurance details without feeling pressured. Makes check-ins smoother, fewer errors.
Plus, it gives you a moment to, mentally prepare.
Yeah.
Review your notes, your questions, gather your thoughts.
And think about it from the provider's side. Being on time helps them stay on schedule. It means they can give you a full consultation without feeling rushed.
That's a really good point. Everyone benefits.
Especially if you need special tests or equipment. Arriving early gives the staff time to prep everything so it all runs smoothly.
So The specific advice was what, arrive 15, 20 minutes early?
Yeah, something like that. Bring all your documents ID, insurance, records, referrals. Have that list of questions ready.
Check insurance details beforehand. Review your history. Maybe bring that support person if needed.
It just makes the whole process flow better. And they noted it helps different kinds of appointments, too.
How so?
Well, for routine checkups, it ensures a thorough review. For specialists, having all the info ready helps them get up to speed faster.
Even in urgent care.
Yeah, having your basic medical info handy can actually speed up triage and getting you the right care quicker. It all helps.
Okay, so let's try and wrap this up. Key takeaways from this deep dive.
Well, first, healthcare accreditation. Bodies like JCI and NABH, they're really vital for setting and maintaining quality standards. It's a serious process.
And organizations like Supreme Medic play that practical role, helping hospitals actually meet those standards on the ground.
But maybe the most important part for our listeners is how much you can influence your own care. Being a prepared patient isn't trivial.
No, it makes a real difference. Gathering records, noting symptoms, listing questions, arriving a bit early and organized.
It significantly improves your experience and helps your doctors and nurses give you the best possible care. It empowers both sides.
So here's a final thought to leave you with. We see all the effort that goes into these quality standards from the organization's side, and we see the relatively simple steps you can take to prepare.
So how can we sort of collectively foster a healthcare system where everyone, providers and patients, feels truly empowered and supported?
Yeah. What other questions do you have about how accreditation works or how you can best navigate your own healthcare journey? Something to mull over.
Definitely something to think about.
Thanks for joining us on this deep dive.